Friday, so it must be time for another legislative briefing. Welcome to your weekly NCMS legislative briefing. We've now passed 109 days of this legislative session, coming up on our 110th on Monday, and we're actually close to a budget, which means that the end could actually be in sight. This week's been a very busy week. The Senate passed their newly refined version of Medicaid reform that did look more like a compromise bill. It included some more language that we've been asking for about patient protections and things like that. It got rid of the authority provision that would have had a new unelected authority taking care of and running Medicaid, and traded that for a new executive branch department that would be the Department of Medicaid, started out from under the Department of Health and Human Services, separate and apart. Would be a secretary level post that would be running Medicaid. It also included a number of other provisions about how the structure would get started, the utilization of health information exchange, which we've been very supportive of along the way, but it still lacks certain things like a requirement for physician leadership and details about exactly what the goals are going to be, what are the outcomes that we're looking for other than this predictability claim that has been looked for so many times, and the obvious move from fee-for-service to some other kind of payment reform. So we're still asking for some more changes. We're looking to the House to not concur with this bill and to go into a conference situation where we could work out and hopefully get some more changes. But I think this is a very strong sign that the possibility of managed care coming in is even more likely than we've thought. And so it's very important that you take the time to utilize our action alert that's on the front of our website. Talk to your legislators about your feelings about this. Utilize the comments that we've talked to you and have communicated to your legislators as well about physician leadership being an absolute must, about goals, clear, triple aim oriented, value-driven goals being an absolute must, data transparency being an absolute must, utilization of the health information exchange. What are we going to do during the transition period? Again, the Senate bill talks about getting rid of CC&C and instead utilizing that money to pay for primary care services, which is wonderful. We're very happy that they're recognizing primary care, but we've got to make sure that we have something in the interim between moving to this new value-driven system where we're going to have new entities in charge of managing Medicaid and leaving CC&C or leaving whatever kind of management program that we're going to have in this state, because those efficiencies have saved hundreds of millions of dollars over the last few years, and we can't afford to find new ways to put that back into the budget. So these are important conversations that we need you having with your legislators. Reach out to us if you need assistance with that. Go to our website, like I said, and we'll connect you straight through to your legislators. But now's the time. We're getting into the short rows. It's no more we can do this in a week or we can do this in a couple weeks. Now's the time, because once they go into this conversation, once the budget starts to move, as we think it's going to start to move over the next 2 weeks, then we're getting very close to an end, and we're not going to have much time to get the changes that you've been asking for all along the way. So we hope that you'll engage. We hope that you'll go to our website and click through, and we look forward to bringing you another briefing next week. Have a great week.